shoulder surgery, you'll usually look something like this. So you'll have a brace on the operative arm, and you'll have a waterproof dressing on over your incisions. If you have an arthroscopy, which means small little tiny incisions, you'll have usually this clear dressing over top. If you have an open procedure like a shoulder replacement or any other open procedure, usually there'll be a waterproof dressing here in the front. We say they're waterproof, but I don't like to test it, so I really like patients to not get the wounds wet for the first 72 hours after surgery. So after surgery, your brace should be on 24 hours a day, 7 days a week, except for when you're taking a shower or getting dressed. So for the first 3 days, again, we don't like patients to take a shower. We really want them just to kind of wash under the armpit. So to do that, you can carefully undo the brace. So there's a strap on top, usually a couple straps on top that will disconnect the sling portion from the pillow, and then a couple straps in the front that can be disconnected. You can disconnect those and then support your arm, just like Afton's doing now. Lay the brace down, and then usually I'll have a family member come, have the patient lean forward just a little bit, and that opens up the space from the back, and use a soapy washcloth just to kind of wash under the armpit to keep the wound clean and dry, but allows you to keep your armpit clean and have it not smell after surgery. Nobody wants that. So that's the best way to kind of keep the armpit clean and to wash for the first 3 days after surgery. After 3 days, patients are allowed to take a shower. A lot of times patients will want to take their dressing off on their own at home, and they can certainly do that after 3 days. If you want to keep the dressing on until your first visit with the therapist, you can do that as well. So when the dressing comes off, you usually just peel this plastic off on the side here. There'll usually be some 4x4s or some cotton underneath the dressing, and once you peel it off, a lot of patients will have what's called steri-strips, little white steri-strips on their skin. Those will hold the wound together. There are stitches underneath there that will absorb, but I like patients just to leave those alone. After they start drying up and shriveling off, they will usually be almost peeling off on their own, and you can certainly take those off. Usually it's a week or two for that to happen. So to take a shower, there are 2 ways to do it. One way is just to sit on a bench or a shower chair and just allow your arm to rest in your lap, and then use the opposite arm to wash your hair, and you can kind of use this arm here to kind of clean and rest the arm here in your lap, and then the arm is not moving and it's supported by the lap. The other way is to get a cheap sling, just a cloth sling. You can get it at our office or any kind of pharmacy usually, and then this could be your shower sling. So you can just kind of strap it on, put the arm in the brace here, just like any other sling, and then you can get this sling wet and then let it air dry in between showers, and this can be your shower sling. So I like the arm supported when patients are taking a shower, just so they're not moving their arm and that the arm is protected in the shower. When you're taking a shower, we just want the water to just run over the shoulder. We don't want it to be beaten down by the shower, and just pat it dry when you're done. Don't really scrub it hard or irritate the wound when you're taking a shower.